Kia ora, good evening. It's the moment the country's health bosses had hoped wouldn't happen for 2 more months. Swine flu is now being spread in the community and not just from contact with people who have travelled overseas. The number of confirmed cases has risen from 34 yesterday to 43. And as Jane Luscombe reports, health officials are warning this may signal the start of a much wider infection in the country.
The government's been planning for a pandemic for 4 years, but it had still hoped to get through the normal winter flu rush before this new strain started to spread among the community.
That's an early indication that we're starting to see some spread in the Wellington community. At the moment it appears to be localised, but of course this is an evolving situation.
So far, 2 patients who've had no contact with overseas travellers have caught swine flu. The public health team is still focusing on containing the spread in the rest of the country for as long as possible.
The issue is that we don't have much immunity to it, and so that means that many people will fall sick. That'll put a lot of pressure on our hospitals and emergency departments.
It'll also affect people's workplaces. At Auckland's Tip Top factory, they've cancelled their ice cream tours and birthday parties to protect their staff from the threat of germ-ridden visitors. Scientists overseas are working on a vaccine, but it's unlikely to be available until the end of September at the earliest, ready for winter in the Northern Hemisphere.
That is of great importance for all countries because it's a new virus and we don't have any immunity to it, so we will need a vaccine soon.
Until then, the New Zealand government has to rely on Tamiflu. The virus has now infected nearly 30,000 people in 74 countries, but deaths have occurred in only 8 of those. So far, 145 people have died, and around half of those have had other complications such as diabetes, asthma or obesity. To put that in perspective, ordinary flu kills up to 500,000 people every year. Jane Luscombe, 3 News.